Hello and welcome to today's lecture. I'm Ibulani and I'll be guiding you through today's topic. In this session, we'll be focusing on nursing management for patients with pneumonia. I hope that you read your textbook before you watch this video, and we are going to review and deepen your understanding about the topic. And this lecture is designed to give you clear, practical insight you can use. We'll walk through the key concepts step by step with examples and explanations to make things as straightforward as possible. So, grab your notes, settle in, and let's get started. Okay, before we begin, let's take a quick look at our learning objectives for this session. These objectives will guide our focus and help you to understand exactly what you're expected to learn and take away from this lecture. By the end of this session, you should be able to understand the pathophysiology and medical management of pneumonia, and also hopefully you are able to formulate a whole nursing process studied from nursing assessment, diagnosis, intervention, implementation, and evaluation for patients with pneumonia. Before we go any further, here is the first critical points for you to remember in this lecture. This isn't just another detail to memorize. It is a foundational idea that will come up again and again, and it is really something you'll need to understand deeply, not just in this course, but later in your real clinical practice. The first thing is pneumonia is an acute infection of the lung parenchyma. So the infection happen and then the inflammation developing and it makes the lungs fills with fluids. The second one is pneumonia is more likely to occur when defense mechanism become incompetent or overwhelmed by the virulence or quantity of the infectious agents. 3. The pathogens can cause pneumonia, reach the lung in three ways: aspiration of normal flora from nasopharynx or oropharynx, inhalation of microbe present in the air, and also the last one, hematogenous spread from a primary infection elsewhere in the patient's body. There are two main classifications for pneumonia. The first one is community acquired pneumonia or CAP, is an acute infection of the lung occurring in patients who have not been hospitalized or live in a long-term care facility within 14 days of the onset of the symptoms. The second classifications is hospital-acquired pneumonia or HAP, also known as nosocomial pneumonia. So this kind of pneumonia that the patient get while in the hospital. For the non-intubated patient, it begins 48 hours or longer after their admission to the hospital. And for the patient with a mechanical ventilation or intubated, it's often called ventilator associated pneumonia or VAP. Okay, next. Here are the risk factors for pneumonia. You can read the slide and also open your textbooks, and I need you to understand that there is a lot of risk factors for the patients to get pneumonia, and also there are four main stages of pneumonia. Please read it carefully on your textbooks. Okay, next, we are going to see the standard assessment for the severity of pneumonia. This is really important for the nursing because this is the first line standard assessment to assess the condition of patients. We are using expanded curve 65. So the expanded CORB 65 scale may use as a supplement to clinical judgment to determine the severity of pneumonia and if the patient need to be hospitalized or not. You can see all the um, main points of this assessment tools, and also there are the scoring and also the decision. and also the decision making. So if the patient scored in range of 0 to 2, it it means that it's on low risk, and also it can be treated outpatient. But for patient in score 5 to 8, it means that they have high risk severity of pneumonia, and the patient need to be admitted to the hospital, especially maybe monitored in ICU. Okay, next. Here is the pathophysiology of pneumonia. I believe that you already watched the video before about the pathophysiology in detail, but I want to remind you that every pneumonia started with inflammatory response, which is the traction of neutrophils, release of inflammatory mediators, and also the accumulation of exudates. And all the fluids and exudates fills the alveoli with fluid and debris, and also increase production in the airway that can cause airway obstruction. All that things make the situation worse in the lungs. So there are decrease in gas exchange, and then at the end, it will develop into the resolution of infection. Next, the interprofessional care for pneumonia. This kind of care is given by all the healthcare provider, especially doctors. This is the guideline for treating patients with pneumonia, and it is really important for a nurse to understand the medical pathway for taking care patient with pneumonia, because you work together with other healthcare providers, especially the doctors. They may start with diagnostic assessment, and for people with patients with pneumonia, you can see they will take the history and also do physical examinations and take chest x-ray, check the sputum, check the gram strain, culture, and also antibiotic sensitivity tests, measuring pulse oximetry or ABG, arterial blood gases, and also take some laboratorium or blood work for cultures, CBC, and white blood cell differential, and also routine blood chemistry to see the signs of infections. For the management, for patient with pneumonia, usually they will encourage the patient to increase fluid intake at least 3 liters a day, and also maintaining with the IV line with IV fluids. The next thing is balance between activity and rest for the patients, giving them oxygen therapy, and also working with physiotherapy to give um, chest therapy, and also VT prophylaxis. And for the acute or severe cases, working with critical care area management, maybe with mechanical ventilation as needed. For the drug therapy for patients with pneumonia, we need appropriate antibiotic therapy that you can see on your textbooks on table 27.6. The antibiotic therapy will differ for every person based on what kind of infection they get, and also what type of bacteria and also viruses that they get. And for the antipyretics, it's for fever, analgesic for pain, and also there are some NSAID or non-steroidal anti-inflammatory drugs if no contraindication for the inflammation. Okay, next we are going to dig deeper about nursing management for patient with pneumonia. And as you remember, our nursing management or nursing process started with assessment. So for the assessment, we have to gain the subjective and also objective data. For the subjective data, you can gain the past health history, whether the patient had history of lung cancer, COPD, diabetes, and other um, diseases. If the is it the patient have story of malnutrition, altered consciousness, and also immunosuppression, and also exposure to chemical toxins, that dust or allergens. It is really important to explore the patient's health history to know whether the patient have disease before or not. The next one, you need to ask about the medication, whether the patient already taken his antibiotics or corticosteroids, chemotherapy, or any immunosuppressants. The last one is surgery or other treatments, whether the patient have a recent surgery, splenectomy, or maybe intubation, or any surgery with general anesthesia, and also history of enteral feedings. All of this data related to the risk factors of pneumonia. That's why it is really important for you to gain the subjective data. Next, you also need to explore about the objective data. You can do your head-to-toe assessment to gain all this data. In general, we will see patient with pneumonia having a fever, feeling of restlessness or lethargy, and also splinting of affected area. For the respiratory system, you may find the patients feeling tachypnea, pharyngitis, maybe asymmetric chest movements, decreased exertion, nasal flaring, and also use of extra accessory muscles to breathe. You can hear crackles, friction drop on your auscultations, and you can feel dullness on percussion over consolidated area, and also increased tactile firmness on palpations. For the sputum, you may find pink, rusty, purulent, green, yellow, or white sputum. It's really important for you to know the colors to identify what kind of sputum that the patient had right now. For the cardiovascular system, you may find the patients in tachycardia. For the neurological system, you may see if there is a changes in mental status ranging from confusion to delirium. And it is really important to check their diagnostic findings that the doctors may order before. Most commonly, you will find leukocytosis in the blood result, maybe with abnormal ABGs, with low order PO2, and so on. Maybe you can find positive sputum on gram stain and culture. And also, you may see they are patchy or diffuse infiltrates abscess, maybe pleural effusion on chest x-ray. So it is really important for you to understand and to look at the diagnostic finding that the patient have in their medical record. Next, after you gather all the data, you need to identify which data belongs to which problems, so you can manage to get your nursing diagnosis. These are the possible nursing diagnoses that may come with patient with pneumonia. There are five priorities. The first one is impaired gas exchange, impaired breathing, fluid imbalance, hyperthermia, activity intolerance. Please go check your NANDA 12 edition book, and you can find that, for example, the first diagnosis, you can find the definitions, and also you can find the characteristic of the nursing diagnosis, and also the signs and symptoms related to that nursing problems. Check your NANDA will help you to understand the trajectory of the nursing diagnosis, and what nursing diagnosis is the priority for your patients. The next one is the nursing outcomes. These are the overall goals that the patients with pneumonia will have. You are expected to have patients with one clear breath sounds, 2. Normal breathing patterns. 3. No signs of hypoxia, of course. 4. Normal chest x-ray. 5. Normal blood count, white blood cell count. And 6. Absence of complications related to pneumonia such as pleural effusion and also pneumothorax. So here is the nursing implementation that you need to do on your patient. As I said before in the first meeting in this semester, we are going to divide the nursing implementation into three parts. The first one is health promotion, acute care, and ambulatory care. The first one is health promotion. There are several things that you can do for the patient with pneumonia. The first one, to reduce the risk of pneumonia, please teach the patient to practice good health habits such as frequent hand washing, proper nutrition, adequate rest, regular exercise, and coughing and sneezing into elbow rather than hands. Second one is avoiding cigarette smoke is one of the most important health promoting behavior, and coughing and sneezing into the elbow rather than hands. The last one is encouraging the patient, especially those at risk for pneumonia, such as people with chronically ill and also older adults, to obtain both influenza and maybe pneumococcal vaccines to prevent or se- to prevent the severity of pneumonia. Okay, the second part of nursing implementation is acute care, which is what this all the implementation related to the patients while they are hospitalized. The first one is the essential nursing care for patients with pneumonia includes monitoring physical assessment parameters, especially the vital signs, providing treatments, and monitoring the patient response to treatment. Second one, prompt collection of specimens and initiation of antibiotics is critical. Collaboration to give O2 therapy, hydration, nutritional support, learning breathing exercise, early ambulation, and also therapeutic positioning are the part of nursing care. Third one is working with respiratory therapy to monitor the patient condition with all physical therapy and also postural drainage and also chest percussion as needed. The next one, place the patient with altered consciousness in a position for side lying or upright that will prevent or minimize the rise of aspiration. Next, turn and reposition patient at least every 2 hours to promote adequate lung expansion and mobilization of the excretion. And the last one, avoid inappropriate use of antibiotics. Collaborate with doctors to remind them to use the right antibiotics to the patient to prevent the development of multi-drug resistant organism. Okay, the last one is the nursing implementation on ambulatory care phase. For the if the patients are getting ready to go to their home or they are getting their care in outpatient department, here are the things that you can do for them. First one is teaching the patient about the importance of taking every dose of the prescribed antibiotics. The patient needs to finish all the antibiotics and um, do it based on the order. Please take special notes for the interaction of the drugs, and also they need encouraged to get adequate rest to promote recovery. Also, you can tell the patient to drink plenty of fluids, at least 6 to 10 glasses per day, and avoid alcohol and also smoking. Also, explain follow-up chest x-ray may be done in 6 to 8 weeks to evaluate the resolution of pneumonia. And also, for the older adult, they may have prolonged period of convalescence. The last one is you should teaching the patient about all the information related to vaccines, especially for influenza and pneumococcal vaccines. The last part of nursing management is nursing evaluation, and here is the expected outcomes and the things that you need to evaluate after you give the nursing management or nursing implementation to your patients. You need to evaluate whether the patient already have effective respiratory rate, rhythm, and depth of respirations. You need to make sure that the patient has clear lungs auscultation, and also there are no signs or absence of infections. That's all about the management um, or nursing care plan for patients with pneumonia. And that's the end of our lecture. We already covered some key points on nursing management for pneumonia, and I hope it helped you to understand the topic better. It may not cover all the things, but you need to dig in on your textbooks and also watch other videos and maybe read some journals to deepen your understanding related to this topic. Please take some time to review what we've discussed in this video, and also feel free to revisit this video whenever you need a refresher. Thank you for watching and see you in the next video.